Hello, it's now 2:00 p.m. Eastern Time. You've joined the 2019 Justice and Mental Health Collaboration Program Orientation Webinar. To allow for additional sign-ins past the hour, we will be starting this webinar in just a few minutes, so please stay on and hold on for just a few minutes. Good afternoon, everyone. Thank you for joining today's 2019 Justice and Mental Health Collaboration Program Orientation Webinar. Today's training is part one in a series of 2 required general orientation sessions and is focused on an overview of the Justice and Mental Health Collaboration Program and training and technical assistance. My name is Allison Upton, and I'm a project manager at the Council of State Governments Justice Center. I will be moderating today's webinar, which is hosted by the U.S. Department of Justice, Bureau of Justice Assistance. To give you an overview of today's webinar, first we will do introductions of our panelists and discuss an array of resources available to support diversion and reentry practices. Next, we'll hear from BJA, who will provide an overview of the Justice and Mental Health Collaboration Program, or JMHCP, as we usually say for short. We will also provide information about the technical assistance process for grantees, and toward the end of the webinar, we'll have time for questions and answers. And just a couple of housekeeping items for all of the attendees. Just to let you know that any time during the webinar, you can ask a question by typing it into the Q&A panel on the bottom right-hand portion of your screen. This includes both technical and content-related questions. We'll try to reply to technical questions in the chat window as we go. For the content-related questions, we will be keeping a running list, and we'll address them at the end of the webinar during the Q&A section. We'll do our best to get through as many questions as possible. If you encounter any technical or audio problems during this webinar, please call WebEx Technical Support at 1-866-229-3239, and you'll notice that we have chatted out this number in the chat box in the bottom right-hand corner of your screen. Please understand that there are some technical issues that you may not be able to resolve, but we are recording this webinar and we will post it on our website by the end of next week. For introductions, to start with, Dr. Aisha Delaney-Brumsey oversees the Behavioral Health Division at the Council of State Governments Justice Center, which focuses on reducing incarceration of and improving outcomes for people with behavioral health conditions. Before joining the organization, Aisha was the Director of Behavioral Health Research and Programming at the New York City Mayor's Office of Criminal Justice, where she helped to advance a number of reforms, including increased investment in the city's crisis response services and supportive housing for people with a history of justice involvement. Prior to that, Aisha was the Director of the Substance Use and Mental Health Program at the Vera Institute. Our next panelist is Maria Fryer, and Maria is a policy advisor for the U.S. Department of Justice, Bureau of Justice Assistance. She oversees the Justice and Mental Health portfolio and collaborates with the CSG Justice Center to assist states, local government, and behavioral health organizations to better understand the relationship between the criminal justice system and mental health populations, and to help create policy and programming that meets the needs of municipalities and the citizens they serve. Maria previously worked at the North Carolina Governor's Crime Commission, where she advised the governor's office on effectively addressing the needs of victims of violent crime. In addition to working with families overcoming violence and instability in Coffee County, Alabama, Fryer has also worked in community corrections in Fayetteville, North Carolina, helping to develop intermediate and community-based sanctions for repeat offenders with drug addiction. She also served in the United States Army as a member of the Military Police Corps. And our next presenter will be Sarah Würzburg, and Sarah oversees the technical assistance for the Justice and Mental Health Collaboration Program and the Second Chance Act Co-Occurring Disorders Program at the Council of State Governments Justice Center. She is the lead for substance addiction. Previously, Sarah was a research analyst at the National Association of State Alcohol and Drug Abuse Directors, where she authored research reports and led youth and women's services. And I want to just say thank you to all of the panelists today for joining the webinar. And now I will turn things over to Maria Fryer to talk a bit about the Bureau of Justice Assistance. Maria?
Great. Thank you, Allison. Good afternoon, everybody. My name is Maria Fryer, and I'm a policy advisor for the Justice and Mental Health Collaboration Grant Program, or better known as JMHCP, in the Policy Office at the Bureau of Justice Assistance, also known as BJA. And I come from many of the community programs that you represent today, as well as from state administration, where I was charged with finding local and statewide solutions for many of the justice-involved clients that you serve through this program. And I look forward to working with you to make your JMHCP grant a success. We have to open this orientation by recognizing and acknowledging your accomplishment first and foremost. You've succeeded in securing grant funding in a very competitive year. Your applications were screened for basic minimum requirements, were reviewed and rated and scored by panels of external peer reviewers. And after all that, an internal review from BJA staff, you were recommended to the Assistant Attorney General for funding. So congratulations on your award. Next, a little bit about expectations. So let's talk about what we might expect from you during your grant project. So since each program was reviewed and selected based on criteria that uniquely qualified them as most competitive, I want to lay out some very specific expectations. So we expect that you would think about how your systems can be more responsive to people with mental illness and co-occurring substance use disorders in the justice system, and that you will take on the planning process and all the grants with gusto, and be excited to work with your TA coach on this, and we are making a difference through this work. You will be using validated screening and assessment for mental illness, substance use, and criminogenic risk. And we expect that you'll seek appropriate services and identify system gaps for serving people with mental illness, as well as that when you need help, you'll seek help from your TA provider and communicate regularly with your coaches and with BJA staff when needed, and that you will have a state policy advisor from our programs office who's assigned to help you with your budget and grants management. So your expectations of us. You can expect that we will support you and assist you as you set out to reach the goals to enhance your systems and reach your program goals. And we want you and your staff to have the necessary tools to serve this critically underserved population to help your community. Both the program staff and the policy staff will be responsive to your inquiries as they arise, whether they're technical, like about allowable uses of funds or changes in key staff or requesting no-cost extensions, or whether they are regarding critical changes maybe at the state level or county or local level that you foresee potentially impacting your program. We will provide quality technical assistance through the Council of State Governments Justice Center. And just a few words about CSG Justice Center. They really brought to light the need to better serve people with mental illness throughout the years in their partnership with BJA. And one of the landmark projects was the Consensus Project, and you may have heard of it back in 2005. So that was quite some time ago, and since then, they've been working with JMHCP grantees and been a partner with BJA for the last 14 years. So you're in good hands with CSG. Each of you will have a TA coach assigned to you by the CSG Justice Center, and we expect that they'll call you and email you and challenge you and support you. And overall, considering everything that we've shared thus far, what we're really trying to achieve is better outcomes for people with mental illness and co-occurring substance use disorders in the criminal justice system. Specifically, we're looking to enhance law enforcement responses, reduce the prevalence of people with mental illness in jails, think through how best to address high utilizers of multiple systems, and improve access and connection to community-based behavioral health care. And this includes important work to develop police mental health collaborations, working towards collaborative county and regional approaches to look at the data to decrease the number of people with mental illness in jails, and have systems think strategically and plan for diversion of people with behavioral health needs. So we're excited for you to work and use data in your systems and develop evaluations track performance measurement through the performance measurement tool. We will talk more about the PMT, the performance measurement tool, we have a lot of acronyms, on the second orientation webinar. Each program has worked hard to get together an advisory group and put together a great proposal, and we want to make sure that you share your outcomes with the field. So about the Bureau of Justice Assistance, and next I'll just tell you a little bit about our office. Basically, BJA is here to strengthen the criminal justice system and to support states, tribes, and local communities. Specifically, BJA provides funding to support law enforcement, combat violent and drug-related crime, and combat victimization. Through the development and implementation of policy, services, and sound grants management, BJA strengthens the nation's criminal justice system and restores security in communities. And as recipients of this award, you each share a common goal to effectively serve people with mental illness and co-occurring disorders in your local jurisdictions, and to create positive system-wide change for people with mental illness in the justice system alongside many other professionals across the nation. I work in the policy office as the policy advisor for the justice systems and mental health at the Bureau of Justice Assistance, as you may know, and I oversee a number of programs pertaining to the intersection of mental health and co-occurring disorders with the criminal justice system, including in this portfolio is the JMHCP and our law enforcement work. We are a small staff dedicated to translating best and promising practices into quality policies and programs for the criminal justice field. Also within BJA is the Programs Office. The Programs Office manages the individual awards that each of you have received, and as such, you have been assigned a grants manager, either Nikisha Love or Tracy Lee Williams. Nikisha or Tracy will be your contact within BJA, with support from Eric Dietrich, who can answer questions pertaining to allowable costs, management of the award, and reporting. You will hear from Nikisha and learn more about their work on the second orientation webinar. We work closely together to ensure that all JMHCP grantees remain on track with their awards. So with this brief introduction and overview, I'll now turn it back over to Allison to talk a bit more about the CSG Justice Center. And you'll hear more from me a bit later. Allison?
Thanks so much, Maria. Next, I'm going to give some background on the Council of State Governments Justice Center. So the CSG Justice Center is a national, nonprofit, nonpartisan organization that combines the power of a membership association representing state officials in all three branches of government with the expertise of a policy and research team focused on assisting others to attain measurable results. Our staff develops research-driven strategies to increase public safety and strengthen communities. This next slide describes a bit more about our work style and how we strive to reflect CSG Justice Center core values, which include a commitment to being independent and nonpartisan in every aspect of our work, providing rigorous, trusted, high-quality analysis, developing practical and innovative solutions informed by data and research, promoting collaboration and building consensus, and being inclusive and respectful of diverse views and experiences. As you can see on this slide, as an organization, we focus on a range of areas within the justice system. We pride ourselves in having a deep understanding of the experiences of people at the front line of the justice system and our ability to gather people from both sides of the aisles and across the country to foster collaboration. We promote smart and effective policy and practice changes through in-depth data analysis, on-the-ground training, direct assistance to state and local agencies, and dissemination of best practices and research. And now I'm going to turn it over to Dr. Aisha Delaney-Brumsey to tell us about the history of the JMHCP and to provide some critical context about people with behavioral health needs in the criminal justice system.
Thank you so much, Allison. And good afternoon, everyone. Congratulations again on your award. We're really excited to begin working with you on this. So as you can see here, JMHCP funding was reauthorized through the 21st Century Cures Act. Included in this bill's range of initiatives are several criminal justice and mental health reform related issues. And this bill is itself a milestone in the fight to address mental illness and substance abuse in the criminal justice system. Through JMHCP, BJA aims to help states, local government, and tribal organizations improve responses to people with mental health conditions and co-occurring substance use disorders who come into contact with the justice system. As you all are well aware, there's a national awareness of the growing crisis of mental illness in the justice system. We've known for some time now that people with mental illnesses are overrepresented in our jails. One of the seminal research papers on this topic found that the rate of serious mental illness in jails was 3 times higher than that of the general population. And of those people with serious mental illnesses, about 3/4 of them had a co-occurring substance use disorder. This is not just reflected in our jail system. We also know that law enforcement across the country is spending increasing amounts of time and resources responding to calls involving people with behavioral health conditions. And here are just 3 examples of how we're seeing that play out in communities across the country. Oregon, mental health calls for service were increasing year over year. And in one Florida county, they found that 1 in 10 calls for service was for a person with severe mental illness. Similarly, in Madison County, Wisconsin, behavioral health calls take twice as long to resolve as other non-behavioral health calls for services. Again, in our court system, we found that judges may sentence people to jail or prison in an effort to connect them to needed mental health services, either because of a perception or a reality that those services do not exist in the community. So as correctional facilities face overcrowding, many communities are engaged in an effort to safely divert people away from the justice system and into community-based services in an effort to reduce their jail population. However, even as those jurisdictions begin to decrease their jail population, we found that the proportion of people with mental illness in the jail remains steady or may even increase. And you can see from this slide that we're living that reality right now in New York. This next slide details a finding from the CSG Justice Center study of the New York City Department of Correction, where we found that people with mental illness booked into the New York City jail had an average length of stay of 112 days, almost double that of the general population of 61 days. And this was even taking into account similarities in charges, risk of rearrest, gender, race, age, and the borough where that person's case was processed. This average length of stay is a common question for grantees, and also a focus of our Stepping Up initiative, which we'll talk about more later on in the webinar. Another issue that's critical to addressing the overrepresentation of people with behavioral health needs in the criminal justice system is the availability of behavioral health treatment services. So as a result of this SAMHSA and Kaiser Foundation studies are summarized in this show, there are significant gaps in connections to community-based services across the country. We can even see that for those people with health insurance, accessing and engaging in mental health and substance use treatment services is challenging. So thank you for that, and right now I'm going to turn it back over to Allison, who will provide us with an overview of behavioral health diversion and reentry strategies using a system focus as you consider your work in your communities.
Thanks, Aisha. So you really highlighted and touched on so many reasons why I think JMHCP grantees are interested in doing this work, right? So grantee team members in attendance today might be thinking about the project funded in their particular jurisdiction. If it has a law enforcement focus, they might be considering what type of approach will work best in their response to calls involving people with behavioral health needs, or how to best help high utilizers of services decrease their future police or jail contacts and lower risk of rearrest. Other teams on the webinar today are considering how to efficiently identify people in their jail or court systems who have serious mental illnesses or support successful reentry back into the community. So through the support of technical assistance, or TA for short, like we say, another acronym, the TA coaches will help you grapple with these questions. We'd like to take some time today in this training to share the variety of resources that will be available to you as you move forward in your grant work. Connecting you with key resources is one important aspect of technical assistance. So the tools and strategies I'm going to touch on today will be a critical support to the planning and implementation of your grant project. So one way that we're addressing this work is through our technical assistance with the JMHCP grantees, where our goal is to think through what the options are for behavioral health diversion and reentry strategies. So the first question that we often hear from jurisdictions is asking about what is diversion in itself, and what would diversion look like, and how would this work across the criminal justice system in their community. So looking at the criminal justice system process as a whole, there are actually many opportunities to design and implement diversion programs and practices. Diversion of people with behavioral health needs does not only happen at one point in the system. People with behavioral health needs may not be eligible for diversion at just one intercept, but actually at multiple points through pre- and post-booking options that could be led by different key stakeholders such as law enforcement, pretrial organizations, courts, and jails. Very importantly, to successfully divert people with behavioral health needs, we really know that we need to use validated screening and assessment processes at multiple intercepts in order to identify potentially eligible participants. And we also need to have in our communities the resources to be able to divert and treat people effectively. So this next slide has a chart which provides a visual flow of the criminal justice system and where diversion can occur, identifying which subparts of the system can take the lead on different initiatives and when. So you can see different key stakeholders, law enforcement, pretrial, courts, and jails can each take the lead on different types of initiatives. And the larger differential here is really between pre-booking and post-booking diversion programs. So along with thinking through the behavioral health diversion strategies, it's important to think through the community-based continuum of treatment services and housing as well, and you'll see that represented on the right side of the graphic here. We're working with grantees to take the great work that they're doing in responding to, screening and assessing, and providing treatment to people with behavioral health needs to help them shift from one-off programs to thinking through a systems-wide strategy. And so on this slide, we're very excited to share a newly released resource just on this exact topic called Behavioral Health Diversion Interventions, Moving from Individual Programs to a System-Wide Strategy. And you can access this resource on the CSG Justice Center website, which we will chat out through the chat box. While the opportunities for behavioral health diversion look different in communities across the country, leaders are definitely seeking opportunities to build bridges across systems to create community-wide strategies that have the greatest impact. Whether leadership comes from the courts or law enforcement or the jails, these leaders are learning that there are key elements that are needed to create a comprehensive, effective diversion response strategy. These key elements or components, which are described in more detail in this document, include developing and engaging collaborative partnerships, understanding the community's behavioral health needs, identifying existing services, supports, and gaps, defining key measures and collecting data, leveraging funding to prioritize interventions, and measuring and sustaining progress. Another resource that we want to highlight is that at a national level, we are really excited to see a lot of focus on pre-booking diversion strategies through this particular resource, which is called the Police Mental Health Collaboration Framework, or PMHC framework for short. This framework outlines core components of a comprehensive and robust police mental health collaboration, or PMHC, that produce improvements in community-wide outcomes. And so, just like what I referenced earlier, this particular resource really focuses on moving small-scale training to agency-wide efforts. So the Police Mental Health Collaboration, or PMHC framework, is a resource intended to assist local leaders, including elected officials, law enforcement and behavioral health agency executives, and their senior personnel who want to begin or improve the existing outcomes of their police and mental health collaborations. The PMHC framework supports leadership to address key areas for focus by considering the following 6 questions on leadership, protocols, training, resource and services coordination, data, and quality assurance for improving performance. So for grantees in Category 2, law enforcement mental health collaboration, this will be the main focus of your grants. Another resource is called Stepping Up, and Stepping Up is a national initiative focused on reducing the number of people with mental illnesses in jails. Since May 2015, when the initiative began, more than 500 counties have stepped up to address this issue. We know that a lot of folks on the call today, on the training today, are part of Stepping Up counties, and so we hope to provide technical assistance that can also link you to additional Stepping Up resources. And this is a main focus area for JMHCP Category 1 collaborative county grantees. The Stepping Up team focuses on a no-nonsense, data-driven approach to public management with steps that have worked in other jurisdictions, such as the development of a shared definition of mental illness, using data to quantify the problem, and tracking progress. Stepping Up assists participating counties with adopting and implementing the 6 questions framework. There we go. Okay. Stepping Up assists participating counties with adopting and implementing the 6 questions framework, which is focused on the areas of leadership, screening and assessment, baseline data, process analysis and inventory of services, prioritizing policy, practice, and funding, and tracking progress. The Stepping Up approach is based on the 6 questions you just saw, and also these 4 key measures to simplify the difficult and challenging work of reducing the number of people with serious mental illnesses booked into jails, in shortening their average length of stay, increasing the percentage of connection to care, and lowering their recidivism rates. There are additional practical resources available on our website to help with the Stepping Up work, including the Project Coordinator's Handbook, the online county self-assessment tool, and a series of in-focus briefs that assist jurisdictions on the ground as they work to reduce the number of people with mental illnesses in their jails. So through our work with JMHCP grantees, we have seen that for systems across the country, it can be very challenging to use data consistently. Data-informed decision-making is tough, and even just identifying people with mental illnesses and co-occurring disorders in the criminal justice system is also difficult at times. And so through the JMHCP, a key focus will be working with you to have accurate data collection and information. Some other challenges that we've seen through our work with JMHCP grantees include identifying system improvement and treatment gaps in the criminal justice system and the community. In particular, there are high utilizers of costly services, so costly services such as police emergency responses, inpatient care, homelessness services, crisis housing, jails, right? So there's, in most jurisdictions, there are these high utilizers of costly services, and it's challenging to identify these folks, track and connect them to services that we hope will lead to positive outcomes such as increased public safety, decreased recidivism, and behavioral health recovery. This goes back to the concept, if you'll remember from the diversion graphic that we showed, this concept of where to focus the behavioral health diversion strategies, and we also look forward to working with you on this challenge. At the practice level, working to balance criminogenic risk and behavioral health needs is a challenge we have also seen across systems and jurisdictions. Other common challenges include creating a consistent feedback loop to support the use of data to inform changes in practice when needed, as well as the implementation of evidence-based practices to fidelity over time. The development of quality assurance processes for screening, assessment, evidence-based practices, and training initiatives are common focus areas. So we look forward to supporting teams on these issues as well through the active cycle of your grants. This next slide details a very key resource, which is called the Criminogenic Risk and Behavioral Health Framework. And this resource was developed to help think through how to identify people with behavioral health needs in the justice system. The identification process starts, as you can see at the top, with criminogenic risk assessment, then moves to substance use disorders and mental illnesses. And so this framework can also be used for prioritizing diversion services. So, for example, you could use screening and assessment to identify potentially eligible individuals and understand more about them. You could also use the framework to differentiate strategies for treatment and supervision based on criminogenic risk level and identified needs, or level of substance use disorder or severity of mental illness. An additional resource that was developed in order to address criminogenic risk and behavioral health needs is a web-based tool to support case planning for diversion and reentry. So this online tool addresses criminogenic risk and behavioral health needs in a balanced way through case planning. It is set to identify a lead case planner from one of three options, either a behavioral health provider, a corrections institution or facility, or community supervision. On this website, on the online tool, we also outline 10 key priorities for implementing collaborative, comprehensive case plans, and this resource is available, again, on the CSG Justice Center website. And when you go online and use this case planning tool, you can select one of the three lead case planner types that I just mentioned. In this case, we have here for you today an example. We selected the correctional lead. And you can see the typical categories of information that a lead case planner would provide and receive from partners such as support, participants, in the arena of housing, et cetera. You can also read case studies from the three different types of jurisdictions corresponding to the three types of lead case planners. And on this web-based tool, you can click on any of the colorful squares to get a sense of what information a lead case planner can give or receive from partners. And so with that quick review of some resources, now I'm going to turn it back over to Maria to give an overview of the JMHCP grant program. Maria?
Great. Thanks, Allison. So the goal of JMHCP, the grant program, is to develop collaboration across the criminal justice and behavioral health systems from law enforcement, pretrial, courts, jails, and community supervision to learn how to have successful partnerships that increase efficiencies and improve public safety and outcomes for people with mental illnesses or co-occurring mental illness and substance use disorders. Next slide. So nearly $146 million has been awarded through the JMHCP grant program to improve public safety and responses to people with mental illness and co-occurring disorders in the justice system. And we were excited to have an increase in funding. Each year it seems to increase just a little bit. We had a dip back in FY15, but now it seems to be holding pretty steady. Next slide. There have been 531 awardees from across the nation representing 49 states and 2 U.S. territories, American Samoa and Guam, and we are proud to have worked around the country to support local programs. This year, there are a total of 49 new grantees, 10 Category 1 Collaborative County grantees, 8 law enforcement mental health strategic planning grantees, and 31 implementation and expansion grantees. We have people working throughout the justice system, law enforcement agencies, pretrial, courts, jails, probation, and parole, and all in partnership with their community-based behavioral health providers, which is required for JMHCP grantees. I'll go over a bit about each grant category, but stay tuned for even more information during the grant category orientation webinars in December. So Category 1, Collaborative County Approaches to Reducing the Prevalence of Individuals with Serious Mental Illness in Jail. This grant has a structured phase process to plan and implement system-wide efforts to address people with mental illness and co-occurring mental illness and substance use in jails. Slide. The grant amount for Category 1 varies based on the size of the jurisdiction, as you can see on the slide, and the grant period is for 24 months. Category 2, Strategic Planning for Law Enforcement and Mental Health Collaboration, is 24 months for a grant amount up to $100,000. Grantees will have a partnership between law enforcement and community service providers to think through calls for service for people with mental illness to improve officer and citizen safety during calls for service with people who have mental illness and co-occurring mental illness and substance use. Category 3, implementation and expansion, is up to $750,000 for 36 months or 3 years. This is better known as our breadbasket of JMHCP because the grant programs vary from one end of the justice system to the other throughout the entire continuum. And these grantees focus on high-risk people with mental illness and co-occurring mental illness and substance use to increase public safety and reduce recidivism. This category has the most variety of programs, as I mentioned, from the very beginning of the continuum with law enforcement onto prosecution and court-based programs. Some are corrections and others are probation and parole initiatives. And all of these programs work across aspects of the justice system. Next slide. So collaborative county grants are a planning process with county leadership toward the goal of reducing the number of people with serious mental illness and co-occurring mental illness and substance use in local jails who can be safely supervised and or treated in the community. For the planning process, up to $100,000 can be spent during the planning phase. And the Planning and Implementation Guide is a key tool for this grant category, which walks grantees through the Stepping Up planning process. It is estimated that this planning phase can take approximately up to 8 months to complete, and your TA coach will provide individualized assistance to each grant program throughout this process. The allowable activities during the Category 1 grant follow the 6 questions that Allison outlined earlier and the 4 key measures of the Stepping Up framework. Establishing a group of county team leaders, developing a plan for screening and assessment, and establishing baseline data are focuses of this area and this grant track. So the goal is to have jurisdictions be able to identify how many people with serious mental illness are in their jails, to work to develop efficient strategies to identify people, refer them to services, and think through a system response. This can involve doing a comprehensive process analysis and inventory of services, prioritizing new strategies for the greatest impact, and using data to track progress. Other allowable activities in this grant category include the design of a data collection and research plan or collaboration with an external evaluator to help track progress toward decreasing the number of people with serious mental illness and co-occurring disorders booked into your local jail. Through your work, you're probably aware of people who are considered high utilizers of intensive services in the community, and that is those who cycle repeatedly through systems using a disproportionate large number who repeat through the system and are using a disproportionately large amount of staffing and response time and other scarce resources. One of the initial steps in addressing this challenge is to develop a data integration or data matching process and to begin analyzing the patterns of these high utilizers. So once collaborative county grant teams have finished a thorough planning process, they can shift into implementing their system-wide coordinated approach and have access to the remaining grant funds. For Category 2, strategic planning for PMHC grants, agencies will be provided practical and actionable written guidance drawn from the successful experiences of law enforcement to design their police mental health collaboration strategy. There are many allowable activities to support the strategic planning process for Category 2 projects. 2 main focus areas will be interagency coordination between law enforcement and mental health, plus courts, corrections, hospitals, housing, and other service providers. Each grantee will designate a law enforcement project coordinator to coordinate outreach, engagement, review data, and handle operations. So Category 2 planning projects will also include a review of existing operational procedures and training protocols used in the response to people with mental illness, and revisions as needed. Officer training is another area where grantees tend to focus in order to better support and provide information on mental illness and co-occurring disorders. Training can include officers and dispatch on topics that will enhance response capacity in your community. One example is the use of premise forms, which allow first responders to gather information voluntarily from citizens who have disabilities or face health challenges to better assist them during emergencies or other calls to their home. Access to behavioral health resources and ability to track mental health encounters are key areas of focus for Category 2 grantees. Thinking through crisis hotlines, warm lines, mobile outreach crisis services, treatment and housing options to try to identify gaps in the system for people with mental illness and co-occurring disorders is important to the development of a comprehensive PMHC. Calls for service and disposition information can inform the priority issues in the community, whether it be repeat callers, high utilizers, lengthy calls for service, or lack of necessary community-based services. Another allowable activity for Category 2 grantees is to develop a data integration or data matching system between law enforcement and community service providers, and to begin analyzing the patterns of high utilizers, which we touched on earlier. Learning more about the calls of high utilizers will provide critical information to systems as they collaborate to respond safely and efficiently to this group. Partnerships with healthcare, behavioral health, emergency services, crisis providers, and homelessness services are critical to being able to look at this type of data. Another exciting opportunity allowable through Category 2 involves a peer learning visit from a team of at least 2 collaborative partners to one of BJA's established law enforcement mental health learning sites. The law enforcement mental health learning sites offer various levels of technical assistance to law enforcement officials and their mental health service provider partners interested in planning or improving their police mental health collaboration programs to improve responses to people with mental illness and co-occurring disorders. In an effort to expand the knowledge base for law enforcement agencies interested in starting or enhancing a PMHC, BJA has added 4 new selections for a total of 10 police departments now acting as national law enforcement mental health learning sites. Technical assistance activities provided by these learning sites include calls, emails, site visits, training presentations, and policy assistance. And as you can see from the data on this slide, demand has risen dramatically, and JMHCP grantees have been very interested in connecting with the learning sites. These learning sites have been a key resource for on-the-ground best practices in planning and implementing a PMHC. These visits are often the highlights of the grant period, and you can receive so much great information from your peers who have been focused on addressing mental illness for years. So on this slide, you can see the 10 police departments selected, which are located across the country in urban, suburban, and rural jurisdictions. These learning sites represent a diverse cross-section of perspectives and program examples and are dedicated to helping other jurisdictions improve their responses to people who have mental illness and co-occurring disorders. Turning now to Category 3, this is our implementation and expansion category. Grantees from across the justice system are all represented. Like I said, this is the breadbasket of our work over the years. All the grantees are working toward developing diversion and reentry strategies for people with mental illness and co-occurring substance abuse disorders. There is an implementation and expansion guide you will work on with your TA coach during the planning phase of the grant. During the planning phase, you can spend up to $150,000. The implementation and expansion guide covers a range of topics to assist teams in a thorough planning process in collaboration with their key stakeholders and TA coach. Completion of this guide is estimated to take about 6 months, and during the planning phase, you can spend up to $150,000, as I mentioned. Once the guide has been approved by BJA, the remaining funds will be released, and you'll be moving on to the implementation phase. We will encourage you to think of your grant project at a systems level, not just about the program or the targeted number of people you propose to serve. We hope these funds support cross-agency coordination and are a jump-off point for your jurisdiction's continued work. Category 3 grantees are funded to provide diversion and reentry interventions at every point of intercept with the criminal justice system, and so there is a wide range of allowable activities that grantees may include in their specific projects. To begin with, training activities can be funded and may focus on enhancing law enforcement response on calls or learning evidence-based cognitive protocols aimed at addressing criminogenic needs. There are many options for training that grantees have used to help decrease the stigma around mental illness and increase the capacity to support people with mental illness and co-occurring mental illness and substance use in the system, while also supporting the personnel working in the justice system. Across different types of training and grant projects in this category, Category 3, the overarching goal is to enhance cross-system collaboration, stakeholder capacity, and to maintain public safety when working with the population of people with mental illness and co-occurring disorders. Supporting cross-training can enhance shared goals and understanding of personnel in other systems. Screening and assessment are another way that Category 3 grantees have used funding in the past. A specific example includes creating processes to identify people with mental illness or co-occurring disorders more effectively. This information can then be used to connect to treatment and other support services more efficiently within correctional facilities or out in the community. And for this grant category, the target is high-risk people, which should be identified through the process of risk needs assessment for program participants. Another available option focuses on community supervision response. For example, law enforcement have previously used funding to support the development of specialized caseloads for people with mental illness or co-occurring disorders that prioritize more intensive supervision for participants who are at greater risk for recidivism. Specialized caseloads have been shown to reduce recidivism and increase access to services for people within that have mental illness or co-occurring disorders. This type of best practice intervention supports both public safety and individual behavioral health recovery goals of the JMHCP. Funds can be used to develop crisis or receiving centers for people who are in the custody of law enforcement. Case management and service coordination focused interventions are often included in grant projects in this category. In the past, grantees have enhanced capacity through different activities ranging from the use of best practices such as crisis intervention for police and first responders to the implementation of evidence-based cognitive behavioral protocols with people being diverted at the pretrial stage to the development of a mental health court docket to reentry case management. As Allison mentioned before, a lot of the work tends to follow the behavioral health criminogenic risk framework. So information sharing is also a critical component of all types of diversion and reentry projects. Allowable activities in Category 3 help enhance capacity in this arena as well. Prior grantees have developed information sharing protocols between jails, courts, and community providers to support successful reentry and have created databases to better track law enforcement service calls for participants with mental illness or co-occurring disorders. We mentioned earlier that the importance of addressing the challenge of the high utilizer of services. Identifying this group efficiently and analyzing their patterns of behavior relies heavily on cross-system information sharing for tracking and ultimately producing positive outcomes. This often includes additional partnership such as emergency services, crisis services, homelessness service providers, and hospitals. So with that, I will now turn it over to Sarah for the next topic that we'll cover today, which is an overview of JMHCP technical assistance. Sarah?
Thank you so much, Maria.
Sure.
Okay, so congratulations again to everyone on your JMHCP award. As your training and technical assistance provider, we are just thrilled to start working with you. And I'm going to talk a little bit about what you can expect from us as the JMHCP TTA provider. So for each of you, you will receive an email before the end of the month from a TA coach. This will be the person from the Council of State Governments Justice Center who will be your main point of contact throughout the life of your grant. In addition to that, a big part of the way that we help you learn is through peer learning. As we've mentioned, we've worked with over 530 different jurisdictions through the Justice and Mental Health Collaboration Program in the past. So we're able to connect you with any of the 130 current grantees or past grantees for peer learning, in addition to the learning sites and the innovator counties, which we'll talk a little bit more about in a bit. There's also resources and tools that we've developed based upon the needs of the grantees. So we talked a little bit about some of those earlier. And there's also resources and tools we connect you from different organizations across the country that might be focused on diversion, reentry planning, law enforcement responses. So a big part of our job is to keep abreast to what's going on in the field in terms of research and practice and be able to give you that information. We also have access to experts. Internally at our organization, we have experts, and additionally, we have 9 partners that are with us on this grant who represent multiple different stakeholder agencies, from law enforcement to prosecution to sheriffs to behavioral health experts. We have contacts throughout the system of experts who are going to help you throughout this process. So I mentioned the TA coach before. So as you can tell, the TA coach is really your air traffic controller. They're able to connect you to different things throughout the system. They'll hold monthly TA calls with you in order to go through the planning process, to orient you to JMHCP, and to help you develop your goals as you go on. So through those monthly calls, you'll be speaking to your coach with your team. There's also the planning and implementation guides, which Maria mentioned as part of the process through the Justice and Mental Health Collaboration Program. These guides are tailored to each of the different grant categories, which you heard are all a little bit different in their focus. But the goal of these overall is to make sure that your cross-systems team and advisory group has gotten together and thought through all the different aspects of the project in order to move towards implementation without having the hiccups that we've seen from other jurisdictions in the past. The TA coach will also connect you with resources on a regular basis. They will learn from you about the types of things you are looking for information on, and they will share that with you on a regular basis. The peer learning I already discussed a little bit, so we will connect you with other jurisdictions. You can tell us the type of agencies you're looking to connect with, the type of jurisdictions that might be doing similar work, and we'll work to connect you. We also have a series of learning communities available. So this year we're offering 5 different learning communities, and we will have additional information about that in a couple of slides. But that's a real way to connect with some of those other experts that we are partnering with on our grant, and to connect with other grantees across the different grant years. We also will have site visits available to the grantees where our TA coaches and another team member and an expert are able to go on site and really talk through some of your challenges and give you recommendations in terms of how to proceed and how to advance your program goals. So as you can see, the TA coach is able to show you how to reach your goals, to connect you with to look at any changes, and to redirect you if there are specific things that we've seen haven't worked well in other jurisdictions. We'll recommend changes or things that you can think about in order to ask those hard questions. So how does your TA coach help you? Basically, they are here to answer any questions. If you are noticing changes in your jurisdiction that might be affecting the grant program as a whole, we can help answer those questions and work with you and work with BJA to think through solutions. We're really going to support you through the planning process for all the different grant tracks and into implementation. Another big topic is often stakeholder engagement. So how do you engage the right stakeholders around the table and really engage new partners, trying to get housing providers, trying to get different agencies beyond your typical scope, maybe supported employment or other employers. Really thinking outside the box in terms of who do you need to connect with in your community to do this work the best that you can. We work with you to think through goals in terms of beyond the scope of your grant, where do you want to go in the future, and how can you actually sustain your activities after the life of the grant. Ideally, we want to see all of these programs continuing their great work for many years to come. So what are other ways in which your TA coach can help you? We really help to think through what the target population is. So who specifically are you serving in your community, and how can you best reach those people? Oftentimes, there will be changes in your system. So when you applied for this grant a year ago, it may look different when you move to implementation in another 6 months to a year as well. So really thinking through how best to reach the people with mental illness and co-occurring disorders or serious mental illness, depending on the scope of your grant, to think through different screening and assessment tools that you can use that are validated and evidence-based, that make sense for your population, whether you're pre-booking or pre-adjudication or post-sentencing. And also thinking through evidence-based practice, so advising on what cognitive behavioral interventions can you utilize to address criminogenic risk. If you're working with women who have trauma issue, are there gender responsive programs that are focused directly on that you can support through this? Another big theme across all the grant tracks, which I think you've heard already, is data collection, performance measurement, and evaluation. So the Bureau of Justice Assistance is very focused on making sure that we're able to show our progress throughout these grants. And oftentimes, you are working with a research and evaluation partnership in order to make sure that you do a process or outcomes evaluation so you can show your work, which ultimately helps with sustainability. We also help think through different options in terms of local, state, federal resources that you can utilize to continue your work. And of course, we'll continue to send you resources, host webinars, provide additional briefs that are based upon what grantees need, so additional information throughout the cycle of the grant. This year, we're also really excited to work with every grantee on a training and technical assistance plan. So each TA coach will have conversations with you all as grantees about what you'd like to see through your training and technical assistance based upon your grant goals, based upon areas in which you think you can improve, and connections you'd like to make in the field. So the TA coaches will work with these on you, and about every 6 months we'll update the TA plans with you, so that way we all have a little bit of a roadmap for where we're trying to go. For each of the grant categories, we have peer learning and really seminal tools for each of the fields. So category 1, as we discussed, is really focused on the Stepping Up initiative and reducing the prevalence of people with mental illnesses in jails. There's also Stepping Up Innovator Counties, which are peer connections we're able to make in addition to past category 1 grantees. These are really different sites in the field who have been innovating on addressing the number of people of mental illness in jails, connecting people with service, and quantifying all this as they work through their system. Through category 2, we have the Police Mental Health Collaboration Framework, which we discussed earlier. There's also the PMHC Toolkit, which is an online resource, and the 10 law enforcement mental health learning sites. In category 3, we're really focused on the diversion interventions, which Allison talked a little bit about. So how do we look not just from the one agency, if you're a court system, how are you coordinating with law enforcement, pretrial services, community supervision in jails as well? We also have criminal justice and mental health learning sites and access to peers throughout the system. So I mentioned briefly the learning communities. So the learning communities are in partnership with different leaders in the field. So for category 2, we'll have a law enforcement and mental health collaboration learning community that will go over key pieces of the planning process for the grantees in coordination with the National Police Foundation. We'll have a specific learning community on gender responsive services for women in partnership with the Center for Evidence-Based Policy and Practices. They also run the National Resource Center for Justice-Involved Women. So this learning community will focus on addressing women in the justice system. Throughout this webinar, you've heard the term high utilizers, and throughout the grant tracks, high utilizers have become a major focus for JMHCP. Through this learning community, we'll work with our partner IGES to work with grantees to discuss how do you select a vendor, how do you look at this data, and how do you move forward in addressing the high utilizers of multiple systems. We will also have an information sharing and evaluation learning community with Dr. Faye Taxman, who's an expert in the field and will be able to discuss process measures in addition to building research and evaluation partnerships and what can those evaluations look like. Our last identified learning community is on trauma-informed care. This will be in coordination with Policy and Research and Associates to address trauma throughout the justice system for both men and women. Wanted to provide a couple of brief examples of some of the past grantees in the different categories. So this example is from Category 1, Collaborative County Grantee, and Hinds County, Mississippi. So as a big focus for this grant was the development of standardized screening for mental illness and substance addiction within their jail system. Hinds County, with assistance from our TA coaches and TA team, was able to implement the Mental Health Screening Form 3 and the Texas Christian University Drug Screen 5, all administered universally at booking in their facility. And this really enabled Hinds County, Mississippi to get data for the first time. So their 3-month data results showed that 43% of people screened positive for serious mental illnesses with an average length of stay for people with serious mental illness of 47 days. This is longer than the average of 38 days for people without serious mental illness. So we're seeing in this jurisdiction what we've seen in many other jurisdictions around the country, is people with serious mental illness are more likely to have longer stays in jails. They also found that 9% of people were connected to care upon release. So this is an area of specific focus for that site moving forward. For Category 2, we have an example from the city of Cedar Rapids, Iowa. So they were working to increase the response time for their mobile crisis outreach team, and they were focused on information sharing and data collection as part of their grant process to look at calls for service, disposition information, and performance and outcome measures. This grantee was able to connect through the Learning Community series with one of the peers, a Justice and Mental Health Collaboration Program grantee from Burbank, California. And through this effort, they heard a little bit about their data collection and analysis. Burbank had talked about where they started from addressing the data collection through Excel and pen and paper methods all the way through building a data system. And through this work, the grantee was able to start collecting data through an Excel spreadsheet, which gave them the information that they were able to capture for the last 8 months of their grant. They were then able to present it to their county leadership, and they were able to sustain the program as a result of having that data, which they didn't have in the past. The final example for Category 3, which is the implementation and expansion grants, is Franklin County, Massachusetts. So this grant is focused on addressing co-occurring mental illness and substance use disorders in the Franklin County House of Corrections in Massachusetts. And they really focused on integrated treatment and direct aftercare service. For the first time in this jurisdiction's history, they actually began bringing women back into their correctional facility and serving women in a gender-responsive way. And exciting outcomes for this. So they were able to look at their 2017 data, in which this is a rural jurisdiction. They served 152 people. They were able to connect 98% of those people with health insurance prior to the release, over half the people with outpatient therapy, 20% of them were released on medication-assisted treatment, and 25% were connected to long-term services. They also had the data on their criminogenic risk and need assessment, which showed that they had 45% at very high risk, according to their risk assessment tool, 28% at high risk, and 9% at medium risk, which left 0% at low risk. So you can tell they were really serving this high-risk, high-needs populations. That's the focus of this grant track. So those are a couple of examples that we wanted to provide. And lastly, I wanted to mention that one of the resources that we have to make sure that you all can get as much information as you can throughout this grant is our behavioral health newsletter. So in addition to the materials the TA coaches will send, this aggregates information from different news stories, different resources from our organization and nationally around the intersection of criminal justice and behavioral health. So we encourage you to sign up just to receive more information. I'm going to turn it over to Allison to facilitate questions and answers. Thank you.
Thanks so much, Sarah. Those were great grantee examples, good food for thought. So now we're going to begin the question and answer portion of the webinar, and we're going to respond to all the questions, I believe, in the time remaining. We'll have plenty of time. And just as a reminder, please, if you have questions, you can chat them in the Q&A box at the bottom right-hand corner of your screen. And also, as we're taking questions, we're going to advance the remainder of our slides so that you can have some key information about, first of all, the upcoming dates for the part 2 of this orientation webinar series and the grant category specific webinar training dates, which are coming up later in December, as you can see. We're also going to show you some key references and resources, presenter contact information, and again, just where you can go to sign up for the CSG Justice Center newsletter. So just another reminder that this webinar has been recorded, and we will be posting it along with the slide deck on the CSG Justice Center website. Okay, so what I'll do is I'll read the questions that are coming in. Just a reminder to please chat them into the chat box, and then Maria and Sarah will be fielding them. So the first question that we have probably will go to Sarah. They're asking, the attendees are asking, when will we receive our P&I guides?
Yes, what a great question, and thank you for asking that. So we have made some revisions to the planning and implementation guides based upon the information of working with the grantees this year. So you'll expect to receive them prior to your orientation webinar. So the orientation webinars is the webinars that were listed in December. So we'll be sure to get you those guides before that webinar.
Great. Thanks so much, Sarah. And separate but in some ways related question, I think will probably go to Maria. So what is the process for BJA to approve the budget narrative? And when is the required training in DC? I'm thinking that the question is related to the financial training, but not 100%. If the person who chatted in that question could clarify if that's not correct, but so I'll direct those to Maria. What is the process for BJA to approve the budget narrative, and when is the required training in Washington, D.C.?
Okay, thank you. So the budget and the budget narrative, originally it goes, you enter it, it's in the system, and the programs office reviews that, and then they send it on to OCFO. OCFO just takes them in the order that they receive them, and then they turn it right back around with feedback if they need any revisions, and then your programs person on the post-award side in the programs office, who really manages the award, post-award on the financial side, they'll provide you with any feedback or corrections or things that are either unclear that need to be sort of corrected, and then they'll send it back to OCFO so OCFO can ensure that it's been corrected. so there's a little bit of this back and forth. I guess that's what I'm kind of describing, and it can take several months. It could take a month. It could take 2 months. If your budget is really, it's, you know, the calculations are all there, everything's allowable, everything's reasonable, it ties right back to your goals and activities in your actual program narrative, you know, and there's no question at all in OCFO's mind as to exactly how those funds will be spent in which categories to support which allowable activities, it could get turned around pretty quick. That would be like 3 weeks or so. I'm hesitant to put a time on it only because, like I said, they go to OCFO in the order that programs reviews them. They go on to OCFO, and then OCFO approves them in the order that they get them. So it's a matter of processing the awards, getting them over there, and then getting them back. I would say if you don't hear anything by, you know, December 1st, definitely reach out to your TA coach, definitely reach out to myself or Nikisha Love and Tracy Williams so that we can kind of see where the budget is in the process and make sure that we get a hold on getting the necessary corrections or getting it moved from one stage to the next. I usually have an audit trail that I can follow. Sometimes it's a quick lookup for me, and I can provide you some quick answers to that. I would not let it go past January. I will just say that's the cutoff date. If you haven't heard anything by then, you should definitely be reaching out. I would never let it go more than a few months without asking some questions. So that's on the budget. On the financial, I think if you're asking about the financial training, that's online. We'll probably be planning some type of event for grantees where we get to have an in-person meeting, but that would be still in the works, and there's more to come on that.
Great, thank you so much, Maria. And I know we're grateful to also have Nikisha Love, one of the senior grant managers on the training today too. Nikisha, if you're able to speak as well, just wondering if you had anything else to add about the budget process.
Yes, I mean, Maria covered that piece. Like I said, it can be a little lengthy depending on when we receive feedback from OCFO after they've done their first review. And then once we send the information to you all, the grantee, it depends on your turnaround when you get it back to myself or to Tracy. And then once we get those back, and then, you know, we have to send them back to OCFO again for review. And again, it is a process because they don't only review BJA awards. You know, we have several different entities within inside OJP. So it all depends on when they get it, and they do go in the order in which they receive.
Great. Thank you so much, Nikisha.
You're welcome.
Yeah. And again, you know, we said it before, but the part 2 of this webinar training will go into much more detail about the financial and grant management aspects. So again, the date for that is November 13th. So we strongly encourage you to listen live if you can to that, because you'll be able to ask questions again around the material. Okay, so another question coming in. It sounds like maybe a team has requested or is thinking about requesting an extension around accepting the grant. So the question is, if an extension on accepting a grant has been approved, how do you know?
Okay,
so
this is Nikisha. I'll take that one.
Great.
You all are still deciding on if you want to accept the award. I'm not sure if I'm your grant manager or if Tracy Lee Williams is your grant manager, but you need to send us an email letting us know your intention on it, that you do intend to accept the award, but you need additional time, and you need to give us a date of the time so that we can note the grant file.
Great. Thank you, Nikisha. And would you want the grantees to include their award number on any emails they send you?
yes, to include the award number. Like I said, let us know that your intent is to accept the grant award, and when you all plan on accepting the award, and you will have to send that to us in email, so that way, because it's actually 45 days from the date of the letter that you received that you have for acceptance. So anything past that, you would just let us know, and then, once we get the email from you all, we can respond back and say, okay, this is fine, approved. That's your way of knowing.
Great, thank you so much, Nikisha. So we have another. Thank you. So we have another question, which I think will probably go to Sarah. It's around the learning community. So one of the team members has chatted in: are the learning communities optional or mandatory?
Thank you, Allison. So the learning community for Category 2, the law enforcement strategic planning, is a part of that grant track, so that is mandatory. The other ones are optional, and we'll be sending more information later this year about the different learning communities and how you can opt in if you're interested in any of those other topics.
Great, thank you so much, Sarah. And we have another question about what will be covered in the category webinars that are coming up in December, and so what are the topics and who on the team should be attending those? So I think probably Sarah would answer that as well.
Yes, absolutely. So that is a great question. So for those grant category specific webinars are really meant to get into the specifics of what the expectations are in your grant track. So in this webinar, we tried to cover a lot of information across each of the tracks. These webinars will be more tailored to the grantees. So for Category 1, you'll have the 10 different jurisdictions on that who received that award. And you'll be able to talk a little bit about your project and hear from past grantees on how they got started and approached the grant. The same will be true for Category 2 grantees. And Category 3 is a bit of a bigger cohort, but we'll go over specific information and have multiple examples from past grantees on how they approached the grant. We recommend having some mental health and justice partners on the line. So depending on the grant track, that could depend on who it was. But really people who you consider part of the core project team would really be recommended, because we'll talk a little bit further about what the planning and implementation guide process is for each grant track and what you can expect from TA. So it's a great basic overview. Then we'll also be working to schedule through your TA coaches, your introduction calls for each of your grantees as well. So we really view the orientation webinars as part of this onboarding process that will give you information and help you to start connect to your peers.
Great, thanks so much, Sarah. And we just have a little bit more of a question around TA providers and guides, so I think they'll both go to you as well, Sarah. Folks would like to know when they will hear from their TA provider, and also sort of a little bit more about what is covered in the P&I guide.
Yes, fantastic questions from everyone. So you'll hear from the TA providers in the middle of this month to the end of this month. So you'll hear from them at latest by the end of November, but at earliest mid-month. So within the next few weeks, you'll be hearing from your TA coach. They'll reach out, they'll give you their contact information, they'll send you a greeting, and they'll work with you to start scheduling that first introductory call to try to get to know you and your team members. The second part of the question was related to planning and implementation guides. And what's in that actually differs a little bit per grant track, because we really try to tailor our efforts towards the different grant tracks. So it really helps you think through stakeholder engagement in terms of your advisory group, thinking through how you're identifying people. So how do you know people have mental illness? How do you know people have substance addiction? Is there specific training that you're undergoing or evidence-based practices you're working to implement, or different models such as pre-booking diversion model, for example. The other piece that's really true across all of them is to look at data collection and evaluation to really start thinking about what you're collecting, how you can make sure you're collecting the performance measurement tool required by BJA, in addition to the long-term evaluations. And all of the guides also have a focus on sustainability. So how do you continue this work past the grant cycle? But we will have the draft guides to you prior to those orientation webinars as well, so you'll be able to look through them, and then on that webinar you can really ask additional questions about the different sections too. You have several months to complete those guides for each of the grant tracks, so it'll be a process of where you can do different sections. You don't necessarily have to do it all in one fell swoop.
Great, thank you so much, Sarah. And just one last question asking, and I think either Nikisha and Maria may want to respond to this, just a question asking about how you know when you're in implementation, when your planning phase is done and you're in implementation for those grants that have, those grant categories that have implementation pieces to them.
So I'll take that. This is Maria. You would basically complete the planning and implementation guide, and you would review that with your TA coach, and then send it on to your programs manager, and then your programs manager is going to share it with me on the policy side. And once it's approved by all, then you can go ahead and begin the implementation phase.
Great, okay, thank you so much, Maria. So that is all the questions we've received for today. If anyone has a last question, chat it in very quickly, but looks like we've covered everything. Is there one more? Oh, one more. Excellent. So the last question is, what is the time frame for site visits for Category 3 grantees? So, Sarah, maybe you would take that, or?
Yeah, absolutely. So thank you for that question. And site visits really are done depending on which time you would need the site visit. So it's possible that we could visit some sites in their planning phase if they're having trouble getting their stakeholder group together, if they need additional support in planning, or it could be in the implementation phase. So it's not necessarily a set time frame. It can actually be any time during the grant. So any time during the 3 years of your grant, there could be potential for a site visit. We try to really maximize the time in which we could have greatest impact and towards in terms of being able to provide additional information or training to the grantee. So that's something your TA coach will work directly with you on if we're able to do a site visit to you. We want to make sure that we're meeting your needs and getting the really trying to advance your project in any ways we can.
Great, thanks so much, Sarah. Okay, so I think unless we get another last minute question, I think it's great we got through all of our questions today, and we will, just a reminder, if we go back one slide, we can see our contact information. Please feel free to reach out to either myself, to Sarah, and we'll be glad to answer any other questions or direct you to the proper source to answer the questions if you think of other additional questions after today. And I just want to say thank you so much to all the presenters on the webinar today, and also congratulations again to all the grantees. And we thank you for your attendance today, and we really are thrilled and excited to work with you as TA providers going forward. So thanks, everyone, and we look forward to seeing you on November 13th on the part 2 of this series. Take care. Have a great day.